Have you ever considered what silent force might be subtly undermining a horse's health, even when, it looks perfectly fine on the outside? Today, we're taking a deep dive into equine hypokalemia. Now, that term sounds complex, doesn't it?
It does a bit.
But it's really about a critical imbalance of a tiny, yet incredibly mighty element, potassium, in our equine friends. Our aim today is really to give you a clear roadmap, a shortcut to understanding this vital health challenge. We want to cut through the jargon based on the great sources you helped gather.
Absolutely. And at its core, hypokalemia just means an abnormally low concentration of potassium in the blood. Usually we're talking below about 2.5 to 3.0 milliequivalents per liter, though, lab values can vary a touch.
Okay?
But what's absolutely crucial to grasp is potassium's huge role. It's the main intracellular cation.
Meaning inside the cells.
Exactly. Overwhelmingly found inside the cells. It's essential for maintaining that resting membrane potential in muscle and nerve cells, regulating fluid balance, and it helps with countless enzyme reactions all over the body. So even pretty small shifts in the potassium level in the blood plasma can have really marked effects on those excitable tissues like muscles and nerves.
All right, let's unpack that. Before we get into the problems when potassium is too low, let's really understand why it's such a big deal for horses.
Yeah.
It's truly amazing how much potassium they naturally consume. I mean, I was surprised reading just how rich their typical diets are. Is it fair to say they're usually sort of swimming in it just from their feed?
Oh, you're absolutely right. In healthy horses, potassium is absorbed really easily by their GI tract, usually way more than their body actually needs. The average equine diet is, incredibly potassium rich.
Like how rich?
Well, to give you some context, just 13 pounds, about 6 kilos of alfalfa hay gives them a massive 145 grams of potassium. And even just average grass hay, say 16 pounds or 7 kilos, that's still providing 121 grams. So yes, they are, as you put it, usually swimming in it.
Okay, so if horses typically get way more potassium than they need from their diet, it does raise a puzzling question. Where does it all go when they become deficient? This was where, the story of hypokalemia gets really intriguing because the causes aren't always what you'd expect.
Exactly. And here's a really critical insight, especially when it comes to diagnosis. While potassium is vital and it's everywhere, less than 2% of the body's total potassium is actually in the extracellular fluid.
Okay, so the fluid outside the cells, including the blood.
Right. And this is a game changer because it means that a single blood test for potassium can often seriously underestimate a horse's true whole body deficit.
Ah, so that's why it can be tricky to catch early.
That's a big part of it, yes. And another key point is the kidney's role. Its ability to conserve potassium, to hold on to it, is actually pretty nonspecific and, inefficient. It takes several days for that conservation mechanism to really ramp up. This makes horses much more vulnerable to significant hypokalemia if they suddenly have decreased intake or excessive losses.
Okay, so given that abundance in their diet, what are the main culprits? What actually causes a horse to end up with too little of this vital element? You mentioned it usually boils down to two main scenarios. Either they're losing too much or the potassium they have is shifting to the wrong places within the body.
That's right.
Let's start with the most common one, increased potassium loss. Where does that typically happen?
Yes, and this is often where gastrointestinal issues really take center stage.
Makes sense.
So prolonged and really profound diarrhea, for instance. Think conditions like colitis, salmonellosis, or Clostridium difficile. That leads to huge losses of potassium and all that fluid and electrolyte-rich stuff leaving the gut. We also see significant depletion with gastric reflux or, nasogastric intubation, especially when large volumes of fluid are lost from the stomach. Stomach fluid actually has a high potassium content.
Right.
And even things like colic or an intestinal blockage, while maybe less direct, they can contribute through major fluid shifts inside the body, effectively trapping potassium where it can't be used properly.
Okay, so the gut is a big one. What about beyond the gut? The kidneys, for example. They're usually pretty good at managing electrolytes, aren't they?
They are, generally. But renal losses are another significant pathway. Diuretic therapy, especially loop diuretics like furosemide, they directly make the kidneys excrete more potassium. Also, excessive urination polyuria from any cause, really. Could be chronic renal failure or psychogenic polydipsia, which is excessive drinking, or diabetes insipidus. If the horse isn't taking in enough potassium to compensate for all that peeing, levels can drop. And less commonly, some specific kidney diseases can directly mess with potassium reabsorption.
And this is the simple one, I suppose, that many horse owners will recognize. Just sweating.
Absolutely. Prolonged, really profuse sweating. You see it a lot in endurance horses or horses in heavy training,
Right.
especially in hot, humid weather. That leads to significant electrolyte loss across the board, including potassium. It's a very common factor, particularly in performance horses.
Right, that makes a lot of sense. Okay, so that covers potassium loss. What about that other category you mentioned where potassium actually moves into the cells? That creates a deficit in the bloodstream, right? It seems a bit counterintuitive.
It does, and it's a really crucial area to understand. Insulin administration, for example. Insulin is well known to drive potassium into cells right along with glucose.
Wow, okay.
So an accidental overdose or even just therapeutic use without enough glucose support can trigger hypokalemia. Similarly, giving large amounts of intravenous glucose, especially without extra insulin, can sort of trick the horse's body into releasing its own insulin burst, causing a temporary potassium shift into the cells.
Interesting.
And then there's alkalosis when the blood pH gets too high, either metabolic or respiratory. Hydrogen ions move out of cells to try and buffer the blood, and potassium moves in to maintain the electrical balance.
And you mentioned something really critical, a kind of aha moment that maybe every horse owner should be aware of. Refeeding syndrome. Can you unpack that one?
Yes, this is a vital one. If you have a severely starved horse and then you rapidly reintroduce carbohydrates, it can trigger this massive, swift shift of glucose, phosphorus, and importantly, potassium into the cells. It happens as the body's anabolic or building processes suddenly kick back into gear after being dormant. This can lead to really rapid and severe deficiencies in the bloodstream.
Wow.
It just underscores how carefully you have to manage renutrition in those emaciated animals. Slow and steady is key.
It's really clear then that hypokalemia is rarely just about a horse not eating enough potassium. If we connect this to the bigger picture, it really highlights how multiple stressors or medical interventions can quickly tip that delicate balance for this electrolyte. It often seems like a domino effect.
That's a perfect way to put it. It's often multifactorial.
So once we understand the why behind hypokalemia, the next critical step is recognizing its footprint. What does this invisible imbalance actually look like in a horse? You said the signs are primarily about impaired muscle function, which makes sense given potassium's role. And the severity usually correlates with how low the potassium actually gets. Signs typically appear below about 1.8 milliQL.
That's generally the threshold where we start seeing clear clinical signs, yes. And what you likely observe is generalized muscle weakness. The horse might just seem sluggish, lethargic, show exercise intolerance. In really severe cases, the horse might even become recumbent, just completely unable to stand.
Wow.
Another really significant sign is gastrointestinal stasis, or ELIS. Remember, potassium is absolutely essential for smooth muscle contraction all through the gut.
Right, for motility.
Precisely. So low levels significantly reduce that gut motility. This often worsens existing problems like colic or reflux or impactions, and it can create that vicious cycle we talked about earlier.
And the heart. You mentioned effects on excitable tissues. What about the heart muscle?
Yeah, while it might be less common or acutely life-threatening compared to hypotassium, severe hypokalemia can definitely cause cardiac arrhythmias, rhythm disturbances. An ECG, the electrocardiogram that measures the heart's electrical activity, might show changes. Things like flattened T waves, maybe prominent U waves, and a prolonged QT interval. Ventricular premature beats and even ventricular tachycardia are also possible, though maybe less frequent.
Okay, and other signs.
You might also notice polyuria, that excessive urination, and polydipsia, which is increased thirst. That's because hypokalemia can impair the kidney's ability to concentrate urine properly. And of course, decreased appetite or anorexia can be both a cause and a symptom, further complicating things.
I remember reading about a very unique sign, particularly in foals, something about their neck.
Yes, that's right. A very specific sign sometimes seen in foals, especially those being treated for rhodococcus equipneumonia with certain antibiotics, the macrolides, is neck ventriflexion. It looks like a downed head posture. They just can't seem to lift their head properly. It really raises an important question, doesn't it? How can one tiny ion have such a widespread, dramatic effect?
Yeah.
It just underscores how incredibly interconnected the body's systems are and why that critical thinking, piecing the clues together, is so vital for vets trying to identify these subtle but potentially very serious imbalances. Yeah. Everything truly is linked.
So, okay, this brings us logically to treatment. If a horse is diagnosed with hypokalemia, what's the plan? How do we get them back on their feet? The focus is obviously on safely correcting that potassium deficit, but also, crucially, addressing whatever caused it in the first place. And I understand doing it too quickly can actually be dangerous.
Exactly. Rapid correction is a major risk, especially for the heart. So when it comes to actually giving potassium back, we have two main approaches. For the mild to moderate cases, particularly if the horse is still eating and drinking and it's not a dire emergency, then oral potassium supplementation is generally preferred. It's the safest route.
Okay, what does that involve?
Well, potassium chloride, KCl, is commonly used. It usually comes in a powder form that can be added to feed or maybe given via a nasogastric tube if needed. You can also strategically use potassium-rich foods, things like alfalfa hay, beet pulp, molasses, and many commercial electrolyte supplements also contain potassium. The dosage is calculated by the vet, of course, but typically might range from, say, 20 to 60 grams of KCl per day, and importantly, it's usually divided into multiple doses throughout the day.
Okay, divided doses. And what about for those really severe critical cases? The horse that's down, maybe.
Right. For those severe cases, the horse that's recumbent or completely anorexic or has really significant GI problems like severe reflux when rapid correction is needed or oral administration just isn't feasible, then we turn to intravenous potassium supplementation for fluids.
And that's where the danger comes in, if not done right.
Precisely. Safety is absolutely paramount here. The KCl must be administered slowly, and it has to be diluted properly within the IV fluids. Veterinarians use very specific calculations for the concentration in the fluid bag, and the infusion rate, the maximum recommended rate, is generally around 0.5 milliequivalents per kilogram of body weight per hour, but often kept even lower initially.
So very controlled.
Extremely controlled and gradual, often infused over many, many hours, because infusing it too quickly can cause cardiac arrest. It's incredibly dangerous. Continuous ECG monitoring is really ideal for these severe cases, and checking blood potassium levels frequently, maybe every 4 to 6 hours initially, is absolutely essential to guide the therapy.
What kind of fluids do they add it to?
It can be added to standard saline, 0.9% ACL, or balanced electrolyte solutions like lactated ringer solution, LRS, which is very common. The key is usually to avoid dextrose-only solutions at first because giving a lot of dextrose can cause that temporary shift of potassium into cells, which is the opposite of what we're trying to achieve.
Right. That makes total sense. It really brings home the point you made earlier about addressing the underlying issue. But is it ever a kind of chicken and egg situation? Because the hypokalemia itself sometimes worsen the primary problem, making it harder to treat.
That's an excellent question. And yes, absolutely it can. It's a classic example of how these things get tangled.
Yeah.
For instance, profound hypokalemia can definitely cause or significantly worsen ileus, that slowing or stopping of the gut,
Okay.
which then prevents the horse from eating or absorbing nutrients properly, which further exacerbates the potassium deficit and potentially other electrolyte imbalances too. You get stuck in that vicious cycle we mentioned. So yes, addressing the underlying cause is absolutely crucial alongside the potassium supplementation. This means actively treating the primary GI disease, whatever it is, colitis, reflux, ileus. It means managing any kidney disease involved. It means ensuring adequate water and proper electrolyte supplements for horses that are sweating heavily. It involves reviewing and potentially adjusting medications like furosemide if they're contributing. And of course, actively encouraging the horse to eat if anorexia is a factor.
It sounds like real detective work sometimes.
It really can be. Piecing together all these subtle clues, trying to find that hidden cause behind the weakness or the gut stasis. It's why a thorough history and exam are so important.
And what about just the general overall supportive care a horse needs while they're recovering from this?
Oh, supportive care is absolutely vital throughout the entire process. This includes appropriate fluid therapy to correct dehydration and maintain hydration, providing good nutrition with palatable feeds as soon as the horse is able and willing to eat, and really excellent nursing care, especially for recumbent horses, things like deep, soft bedding and frequent turning to prevent pressure sores and other complications. And as we mentioned, that continuous monitoring of electrolytes, ECG if indicated, and just the horse's overall clinical signs, alertness, gut sounds, muscle strength, that's non-negotiable.
So when all these steps are followed carefully, what's the general prognosis? Can horses typically recover well from hypokalemia?
Generally, yes. The prognosis for hypokalemia itself is usually good if the underlying cause can be effectively identified and treated, and if the potassium levels are corrected safely and appropriately. However, severe unmanaged hypokalemia can certainly be life-threatening. That profound muscle weakness, the GI dysfunction, the potential cardiac arrhythmias, those are serious complications.
Right.
The prognosis becomes more guarded. or less certain if the underlying cause is itself very severe or chronic, think intractable diarrhea that just won't resolve, or end-stage renal failure, or if significant complications develop, things like aspiration pneumonia from reflux or laminitis, which can sometimes occur in critically ill horses.
It's truly incredible, isn't it, to reflect on how these seemingly minor imbalances, these tiny ions, can have such profound effects on an animal as strong and, well, magnificent as a horse. We've really seen today how complex and interconnected the body's systems are, where even just a little bit too much or too little of something like potassium can have such a dramatic impact. It makes you wonder, if potassium is normally so abundant in their diet, how do horses ever run out? It's kind of like having a full gas tank and suddenly finding yourself on empty. Usually it means there's a serious leak somewhere.
That's a great analogy. This deep dive into equine hypokalemia really does highlight how the health of any animal is such a delicate balance, and how understanding the really nuanced roles of elements like potassium can truly unlock deeper insights into their well-being. It really prompts us to consider, doesn't it, what other invisible elements or factors might be silently shaping the health and performance of the animals or even the complex systems all around us.